Angelica Simmons-Wade, Today we'll be exploring a relatively commonly used and important Chinese herb, Tao Ren, or peach kernel. This herb is used in Chinese medicine to regulate or move the blood, which can be used in a wide variety of conditions, including menstrual disorders, traumatic injuries, and different types of pain. Plus, as a seed, it can moisten the intestines and unblock the bowels. And as usual, we will be exploring something a little different. We're going to continue our discussion of the wiry pulse. Please join us for this interesting and useful episode. Before we get into that, I have a question for you. Did you know that I have written a couple of books? First book is Integrative Pharmacology, combining modern pharmacology with integrative medicine. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. It is also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the same page. It's not only a great book explaining pharmaceuticals, it is also available at an amazing price. It's available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy to digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it is also 10% off and signed by one of the authors, me, all for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com. That's Spurbs, SPURBSHERBS.com. Okay, so we've been talking about the Chinese pulse for a little while now, getting into some specific pulses. In episode 65, we introduced both the slippery and wiry pulse. Since that was a very important, very big herb, Fu Ling, we were not able to get too much in depth in these two commonly felt pulses. I'd like to correct that and go in depth into the wiry pulse in this episode after tackling the slippery pulse in the last episode. We will reiterate what we learned in the Fu Ling episode and then go deeper into how to feel and what the wiry pulse means. The wiry or Xian pulse, also known as stringy or bowstring pulse, feels taut like a guitar string. It is thinner, more taut, and harder than the tight pulse. The wiry pulse really hits the finger. And this is all from quotes from Maciocia, who is just one of the main authors of he's written many of the major textbooks that we study in Chinese medical school. One of my mentors said it should hit all three pulse-taking fingers at the same time. It can indicate several conditions, including liver disharmony, pain, and phlegm. Flaws, which talked about previously, but Bob Flaws is actually contributed to my book on integrative pharmacology. I know him; he's a great guy, very knowledgeable. He wrote a book called "The Secrets of Chinese Pulses" or something along those lines. It's in the bibliography, and that's where I take some of this from as well. So he says the wiry or bowstring pulse is fine, long, has strength, feels like a zither string. Zither, if you're not familiar with that, that's almost like it's a strummed instrument, sort of like a guitar, but not exactly. There are two pulse images which words fail to adequately define and which must be pointed out to the student in a living person. These are the bowstring pulse and the slippery pulse. Although the bowstring pulse is described as being long and fine, The fact that it feels like pressing on a fine guitar or violin string is its clearest verbal description. When one feels this pulse, one does get a sense of its longitudinal dimension rather than its wrist, its width rather than its width. Thus, it is said to be long. However, it should not be confused with the long pulse. Likewise, it is said to be fine. However, it should not be confused with the fine pulse. It is fine specifically in comparison with another of the main pulse images, the tight pulse. The bowstring pulse is forceful and taut or tense. One can clearly feel its crisp and distinct edges. Sometimes this bowstring quality only reveals itself when one changes pressure or rolls one's finger slightly up and down the pulse. In other words, it is not always immediately perceptible quality when present, but sometimes must be searched. In particular, the bowstring pulse tends to reveal itself when one slightly lets up on the pressure. The bowstring pulse is an extremely common pulse image, and therefore there are no lack of models with this pulse. Once it is pointed out and felt for oneself, it is like sugar in one's mouth. That time forward, one immediately knows what a bowstring pulse is like. He continues later on in the book. The bowstring pulse is a tense, constricted, constrained pulse. It occurs when the qi is not able to flow without constraint. There are two basic mechanisms associated with inhibited and non-freely flowing qi. The first is due to the viscera whose job it is to maintain the free and uninhibited flow of qi, and the first of these viscera is the liver. The liver controls coursing and discharging. If stress, frustration, resentment, and anger cause the liver to lose command over coursing and discharging, the qi may not spread freely, thus giving rise to constraint and a bowstring pulse. However, for the liver to function, it must receive adequate blood to nourish, emoliate, and harmonize it. This means that blood vacuity may also result in the liver's loss of command over coursing and discharging. Secondly, the spleen is the root of qi and blood engenderment and transformation. If, due to faulty diet, overtaxation, or excessive thinking and worry, the spleen becomes weak, it may not engender sufficient qi to empower movement, remembering that it is the qi which moves the blood. Likewise, it may not engender sufficient blood to nourish the liver. Therefore, spleen qi vacuity can cause or contribute to qi stagnation. And third, it is the warmth of the life gate fire which warms and empowers the liver. If kidney yang becomes vacuous, this may also indirectly result in or aggravate liver depression, qi stagnation. So the life gate fire is Ming Men is a very interesting concept in Chinese medicine. It's where they say our yang kind of resides and the heat of the body comes forth. So it's an interesting Chinese concept. But there you go. That's what that's referring to. And the second basic cause of lack of free and uninhibited flow is due to yin obstruction. If for any reason dampness, phlegm, food, or blood becomes static and stagnant, this will hinder and obstruct the free flow of qi. Therefore, the presence of any of these so-called depressions can also result in a bowstring pulse. So there you go. That's our little bit more in-depth discussion of the wiry pulse. And with that further discussion, let's get into today's herb. Today we're talking about Tao Ren or peach kernel. This is in the Rosacea or rose family. The species is Prunus persica L. Batsch, B-A-T-S-C-H. Again, the L and the Batsch refer to the biologist who classified this tree. And that's called Tao. So that's where Tao comes from. Or sometimes you might see it as Prunus davidiana, Car Franch. and that's called Shan Tao. Shan Tao. That is less commonly used and is not considered as effective or as strong as Prunus persica. The medicinal part that we're talking about here is the pit or kernel. Actually, I found lots of medicinal uses of various parts of the peach tree, the leaves, the bark, the fruit, all of that. But right now with this Chinese herb, we're just talking about the pit or kernel. And that's actually what Tao Ren means. The English translation is peach pit or seed. Ren means seed. So that's that. Other names include Persica, Tao Ren, Da Tao Ren, Hua Tao in Jiangxi, which is a province, Mao Tao Ren, Tao He. We're going to find out the oldest mention of this is in the Shendong Ben Sao Jing of the Divine Farmers Materia Medica, and they actually refer to it as Tao He. In Japanese, it's tonin, and in Korean, it's doin. Bensky, so remember we have three major texts and I'm adding a whole bunch of other texts with this one as well, but Bensky and their team is one of our major texts. They say the dosage is 3 to 9 grams. Chen and Chen, one of our other textbooks, say the dose is 6 to 10 grams. And Brandon Wiseman, our third major textbook, say it is 5 to 15 grams. So anywhere from 3 to 15 grams seems to be the range here, with everyone kind of 6 to 9 or 10 is probably the most commonly used. Talk a bit about the Rosacea family before we get into more about this specific herb. The Rosacea rose family is a medium-sized family of herbs, shrubs, and trees in the order Rosales, comprising 4,828 species and 91 genera. Many edible fruits are in this family, including apples, pears, quinces, apricots, plums, cherries, peaches, raspberries, loquats, one of my favorite fruits, strawberries, rose hips, hawthorns, and almonds, as well as many ornamental trees and shrubs. Most are deciduous, though some are evergreen. While they are present worldwide, they are particularly diverse in the northern hemisphere. Okay, so back to our herb of the day, Tao Ren, peach kernel. The category for this is interesting. So usually when we look at the three texts, there might be some slight language differences between those three texts, but in general, they're in agreement, as to what this is. In this case, is a little different. So Bensky and his team put this herb in the herbs that invigorate the blood subcategory under the herbs that regulate the blood category. So invigorate the blood, regulate the blood to me are pretty synonymous, but there are other subcategories under regulate the blood category which are not. And so that's an interesting distinction. Chen and Chen say it is in the blood invigorating and stasis removing herbs category. So they just have a category that's called blood invigorating and stasis removing herbs, does not have any subcategories to that at all. So that's an interesting one. Again, not that far from Bensky, but less hierarchical, I guess. And Brandon Wiseman say it is in the blood quickening menses regulating medicinal subcategory. So again, they're adding in menses regulating, which is interesting that is a totally different sort of subcategory. And they put it in the blood quickening stasis transforming medicinals category. So it's in the subcategory of blood quickening menses regulating medicinals under the category of blood quickening stasis transforming medicinals. So interesting combinations, again, in the ballpark of each other, but some interesting distinctions between our three textbooks. Bensky and his team say it is bitter and sweet. It has a neutral temperature and enters the heart, large intestine, liver, and lung channels. Brandon Wiseman agrees, but adds it is slightly toxic, which we are going to get into in today's episode. While Chen and Chen does not include the sweet taste. So that's an interesting one. Nor does it talks about toxicity, but not as a toxic herb. History of this, both Bensky and his team and Chen say the original source for this herb is the Shendong Ben Sao Jing, or Divine Husbandman's classic of the Materia Medica in the second century CE. So remember, the Sennong Ben Sao Jing is the oldest existing book on individual herbs in Chinese thinking. I'm not going to say outside of Chinese, but in the Chinese, that's what we have. So it basically means this is an old herb in Chinese medicine. Let's talk about that herbs that invigorate the blood category that we have under Bensky. Bensky has great commentary over these categories. So this appears to be our first herb from the herbs that invigorate the blood category. We've covered formulas from this category, but not an individual herb. So according to Bensky and his team, herbs that are used to facilitate the flow of blood in the vessels, augment its movement, and reduce areas of blood stasis are said to invigorate the blood, or huo shui. Huo shui. Shui is blood. Huo means to invigorate. When the flow of blood has been slowed, obstructed, or becomes static, it can lead to many types of problems. In general, herbs that invigorate the blood are acrid, bitter, and warm. Which is interesting because this herb is not acrid and it's not warm. It is bitter though. Okay. Acridity disperses what is static and promotes movement through areas of stagnation. Bitterness facilitates the flow in general and downward flow in particular. Warmth not only increases movement, but can also facilitate flow through the vessels. Herbs that invigorate the blood are therefore very mobilizing in nature and should be used with caution in those who are pregnant or have a tendency to bleed, either constitutional or as a result of other treatments, such as taking blood thinning medication. Herbs that invigorate the blood are widely used in contemporary Chinese medicine, both in areas of specialty and for a wide variety of disorders. They are particularly useful for problems marked by the following signs and symptoms: pain, general or localized. When local, the pain is usually stabbing, clearly localized, does not move about. That is what we would refer to as blood stagnant pain. Numbness and paresthesias of the limbs. Paresthesias is that tingling sensation when you have a limb, like when it's cut off circulation, you have that ants crawling sort of feeling. Those are called paresthesias. The presence of masses or lumps, either internally or near the surface of the body. Masses due to bleeding, including those associated with trauma. Bleeding of any kind where the blood is dark purple and accompanied by clots. Dark purple stasis spots on the skin, mucous membranes, or tongue. Associated disorders include amenorrhea, or not having a menses, abnormal uterine bleeding, postpartum abdominal pain, chest painful obstruction, hypochondrial pain, pain due to wind damp painful obstruction, abscesses and other types of sores, abdominal masses, traumatic pain, including that due to fractures, and the pain of tumors. Blood stasis can occur for many reasons, including externally contracted wind cold or wind dampness, the drying and congealing actions of warm pathogen diseases, obstruction due to dampness and phlegm, and trauma. Irrespective of the reason, the underlying etiology must be addressed along with the blood stasis. In this way, blood stasis is similar to phlegm in that it is a secondary pathogenic influence. In other words, treatment must address not only the stasis, but the primary agent that led to its formation. Similarly, because of the interdependent relationship between blood and qi, when one desires to invigorate the blood, it is often helpful to simultaneously promote the movement of qi. The four major categories of blood invigorating herbs in ascending order of strength are those that harmonize the blood, he shui, promote the movement of blood, xing shui, dispel blood stasis, chu yu, and the harsher ones that break up blood stasis, ho yu. In this text, the term invigorate the blood is general in nature, is not specific to any particular strength or function. The categories of blood invigorating herbs are themselves wide-ranging and relative and should not be taken too literally. Let's talk about good quality Tao Ren. Bensky and his team say good quality consists of a large, flat, but full enclosed seeds with white and oily kernels. In Chinese Medicinal Identification and Illustrated Approach, this is a great book that talks about quality of herbs. Zhao and Chen say superior medicinal materials reddish brown in color, and the pieces are consistent, full, and firm. They have a flat, long oval shape and are yellowish brown to reddish brown in color with a thin seed coat with two off-white cotyledons that are oily. So cotyledons are an embryonic leaf in seed-bearing plants, which this one is, one or more of which are the first leaves to appear from a germinating seed. So when Bensky says white and oily kernels, they're saying without the skin on. We're going to see that's an important distinction. This description from Zhao and Chen do talk about the skin being on. That's the yellowish brown to reddish brown in color. The odor is faint, and this is back to Zhao and Chen. The odor is faint, and the taste is slightly bitter. They add for decoction, the skin is removed, leaving just the cotyledons. So there you go. Okay, what does it do? Chinese medical actions. According to Bensky and his team, Tao Ren breaks up blood stasis, is an important herb used in resolving many kinds of problems associated with blood stasis, including menstrual disorders, abdominal pain, traumatic injury, flank pain, lung abscess, and intestinal abscess with fixed abdominal mass. It also moistens the intestines and unblocks the bowels for constipation due to dry intestines. This is what most seeds do, sort of added on to most seeds because of the oil content of the seeds. It moistens the intestine and unblocks the bowels. Very common. Chen and Chen say it activates blood circulation, removes blood stasis. It also drains abscesses, as well as moistens the intestines and relieves constipation. So again, very similar. Brown and Wiseman, again, very similar, say it quickens the blood and transforms stasis, moistens the intestines, and frees the stool. Zhao and Chen say it invigorates the blood and dispels stasis, moistens the intestines, and frees the stool. Now, you might say freeze the stool is what Brandon Wiseman said, and freeze the stool is what Zhao and Chen says. Well, what's very interesting is Eric Brand of the Brand and Wiseman was also one of the editors on Zhao and Chen's book. So it makes sense that some of the language is going to be similar between those two books. And then we have that Shendan Ben Saojing, the Divine Farmer's Materia Medica, and they say it is bitter and balanced. It mainly treats blood stasis, blood block, conglomerations, and evil chi. It kills small worms. So that's an interesting one. A note to this entry says Tao Ren relaxes the liver, generates new blood, and drains stagnant blood. That's an interesting thing because this draining of stagnant blood, we're going to see come up with some of the comparisons with the other herbs. And that's actually an important aspect of this, that this kind of drains stagnant blood downward. And it's because of that bitter taste. Remember, we said the bitter taste is flow and flow downward. And so this is definitely a bit of a downward flowing herb. There are several preparations of this herb, and they are listed in Bensky's and his team's book. And here's a quote from them. The fruit is harvested in autumn when it is mature and the kernels are full and solid. The kernels of the summer fruit are too small to use. The flesh of the fruit is removed and the seeds collected, from which the kernels are extracted by striking the side of each seed until it splits. This is called cleaned peach kernel or Jing Tao Ren. Procedure is mechanized in large-scale production. Peach kernels are also known as Dao He Ren. Stripped peach kernel or Guang Tao Ren. In some place, the outer coat is not removed, but when they are, the cleaned peach kernels are boiled in water for 10 minutes until the seed coat wrinkles, then placed in cold water and the seed coat is rubbed off. They're then dried in the sun and any blackened kernels or extraneous material is removed. Transforming the Significance of Medicinal Substances, or the Yao Ping Hua Yi, written in 1644, explains the traditional view of this procedure. If used without removing the seed coat in large doses, it then travels the liver channel and primarily breaks down the buildup of blood, drives out menstrual blood, treats pain all over the body, numb, painful obstruction of the four limbs, and hemiplegia. If used with the coat removed in small doses and pulverized, it then enters the small intestine, treats blood dryness, constipation, and difficult stool because it moistens, cools, and harmonizes the blood and has the power to open clumps and unblock stagnation. When the kernels are ground into a paste before using, they are called peach kernel paste or Tao Ren ni, or broken up peach kernels Tao Ren. And this method facilitates decoction. We have dry fried peach kernel or Tao Ren. The peach kernels are dry fried until yellow. Dry frying strengthens their ability to break up blood stasis. There's also the view that it increases the moistening quality of the kernels. Seeking accuracy in the Materia Medica, the Bensao Qiu Zhen, written in 1773, advises to moisten dryness, remove the tip and seed coat, then dry fry. There's also defatted peach kernel. Literally, the English translation of this is peach kernel frost or Tao Ren Shuang. Clean peach kernels are wrapped in oil-absorbent paper and then pressed. The paper is replaced, the process repeated until no more oil can be expressed. This defatting process completely eliminates the intestinal moistening effect without reducing its ability to invigorate the blood and dispel stasis. It is appropriate for blood stagnation in patients with loose stools due to spleen deficiency. Continuing with preparation, Chen Tao Ren seeds should be crushed prior to decoction. The unprocessed herb has a strong effect to move the blood and eliminate blood stasis. The dry fried herb has a strong effect to moisten dryness and treat constipation. Brown and Wiseman say the usual processing of boiling to remove the skin reduces toxicity. Without further processing, it is stronger for quickening the blood and dispelling stasis. Stir frying moderates its blood quickening action, so the stir fry form tends to be used to moisten the intestines and harmonize the blood. In either case, Tao Ren should be crushed before decoction. So similar thoughts between the different books, different ways of expressing it. Western uses. It appears peach pits are used medicinally in many Western herbal traditions. Wood describes the use of various parts of the peach tree for several conditions, including a tincture of peach pits and brandy to help baldness. Another article discusses peach pit tea is an effective folk remedy for drawing out poisons and killing infections, as well as warm peach pit tea is excellent for pulling infection out of mouth sores and speeding the healing process. And infected sores can also be remedied with this powerful pit when the tea is applied as a compress. The PDR for herbal medicines does not mention this herb, which is a big giant book on Western medicines, herbals. Let's talk about some commentary. Again, Bensky has some great commentary on these herbs, and this is from him as well. I say Bensky and his team has, as usual, has an excellent commentary on this herb. Bitter and thus draining, heavy in weight and thus sinking and downward directing, and moist in texture, the range of action of Persicae Semen or Tao Ren, I should say, is determined by the channels it enters: heart, liver, lung, and large intestine. Its affiliation with the heart and liver indicates its action on the blood, but it also moistens the intestines that are dry to relieve constipation, stops cough and wheezing, and moistens the skin, all of which relate to the large intestine and lung. While it is generally conceded by most Materia Medica texts that it is almost wholly attacking in nature, breaking up blood stasis, its status as a fruit kernel implies some life-giving generative force as well. In Tao Ren, this is expressed as the ability to assist in the generation of new blood following the expulsion of old stagnant blood. In some cases, too, its effect in the treatment of wind painful obstruction is noted. This effect is based on the restoration of normal blood movement, which both eliminates pathogenic wind and begins to supply nourishment to those areas that were damaged by the pathogenic occupation. Primary action of this herb is on the blood, as indicated in the Divine Husbandman's classic of the Materia Medica. That's the Shenang Benzo Jing we're talking about, where it says, governs stagnant blood, amenorrhea, mobile and fixed abdominal masses, pathogenic qi, and the killing of small parasites. The term pathogenic qi is glossed by some as referring to abdominal masses, but most other writers agree that it refers to infestatious disease, Jubing, a wide category of contagious and demonic illness. According to records of thoughtful differentiation of materia medica, the Ben Sao Si Bien Lu, written in 1904, this is because the peach tree is the tree of the West and contains the essence of the five trees. But whether the classic of materia medica is here referring to evil demonic qi when it uses the two characters pathogenic qi, there's no way to know. Miscellaneous records of famous physicians, the Mingyi Bie Lu, circa 500 CE, states that it stops cough and upward rebellious qi, reduces hardness in the area below the heart, eliminates sudden violent hemorrhage, breaks up mobile and fixed abdominal masses, unblocks vessels, and stops pain. Materia medica of combinations of the De Pei Ben Sao, 1761, adds that it treats blood clumping, blood buildup, blood stagnation, and wind painful obstruction. Regarding its effect on the large intestine, transforming the significance of medicinal substances, or the Yaoping Hua Yi, written in 1664, says that it is moist in texture, it can enrich intestinal dryness, entering the large intestine, it treats parched blood causing blocked stool and dry blood causing difficult stool. The detailed materia medica, the Ben Sao Xiang Jie, written in 1681, observes, bitter, sweet, and neutral, it sinks and directs downward, yang within yin. The bitterness of Tao Ren drains stagnant blood, and its sweetness generates new blood. It has four uses: to treat heat entering the blood chamber, to drain stagnant blood in the abdomen, to expel blood heat, dryness, and itching in the skin, and to promote the movement of congealed blood stasis in the skin. Records of thoughtful differentiation of materia medica explains these references to skin. Peaches have a fuzzy skin and are a lung fruit. The kernels primarily attack stagnant blood and are a liver herb, but it also dredges stasis of the skin, interstices, and pores. And that's our commentary on this herb for today. Let's compare it to a couple other herbs. Bensky, actually only one other. Bensky compares it with one other, which is Carthami floss or Honghua. This is safflower, is what this is. Both herbs dispel stasis and unblock menstruation, invigorate the blood, and stop pain. However, Carthami floss Honghua is light in weight so that it floats and travels in the exterior and upper body, and in overly high doses can raise the blood excessively into the head. By contrast, Persicae Semen Tao Ren is heavy, such that it sinks and directs downward, attacking blood stagnation in the lower body and the interior, while also moistening the intestines to treat constipation and stops coughs and wheezing. Combinations. Bensky also and his team also includes Carthami floss Honghua as a combination with Tao Ren, as well as a frequently mentioned herb, Armeniaceae semen or Xing Ren. We see that a lot. That is a Honghua is a blood moving herb, just like Tao Ren is. Xing Ren is for phlegm, especially in the lungs. So very different, but it's still a semen means seed, so it's still seed. And it has the Ren portion, which means seed. So Tao Ren, Xing Ren. Okay, so let's talk about with using Tao Ren with Carthami floss Honghua. This is an extremely common combination for invigorating the blood, as both herbs strongly promote the flow of blood, dispel stasis, and enter the channels of the two major blood organs, the heart and liver. It's often used for all types of blood stagnation. For example, dysmenorrhea and amenorrhea in gynecology. Dysmenorrhea means painful menses, and amenorrhea is not having menses. Swollen, painful sores in external medicine, and pain in the chest and abdomen in internal medicine. When blood stasis is severe, the dosage must be rather large, 9 to 12 grams each, whereas to regulate and harmonize blood flow, a smaller dose is appropriate, 3 to 6 grams. So our combination with Armanaceae, semen or Xingren, this is both are fruit kernels with which moisten the intestines, but the focus of treatment for Armanaceae, semen, Xingren is the upper body, for Tao Ren, the lower body. This provides a remarkable trickle-down effect, which first facilitates peristalsis above by directing the lung qi downward, and then continues in the lower body through the moistening, blood-invigorating action of Tao Ren on the large intestine. This combination works best when constipation is caused by lung qi constraint, when the lungs fail to provide normal rhythmic descent to guide the large intestine. Shangbing Chung notes that while these kernels are similar in nature, one moves into the liver channel at the blood level, the other moves into the lung channel at the qi level. Thus, the pair addresses movement of both the qi and blood because the flow of qi supports the movement of blood. This combination can be used when blood stasis leads to pain in the chest, abdomen, or throughout the body. While the knowledge that Armanaceae, semen, Xingren enters the lungs and calms wheezing is commonplace, the fact that Tao Ren also possesses this action is less well known. Yet one of the earliest discussions of materia medica, the miscellaneous records of famous physicians, records that Tao Ren can alleviate cough and direct rebellious qi downward. Thus, the pair is also effective for wheezing and cough due to lung qi constraint. So that is our combinations today. Let's talk about contents. According to Bensky and his team, the contents of this herb include glycosides, specifically among them amygdalin and prunicine. Amygdalin is the constituent of most concern when it comes to toxicity. It can be a precursor for HCN, hydrocyanic acid, or cyanide, which is a potent poison. It is also considered to be important to many of the clinically beneficial effects of this herb. They actually think that amygdalin is actually what causes a lot of is considered one of the most important constituents that has benefit. So it can be transferred into poison or it can be of benefit, which frankly, if you know a lot about medicine, you realize that a lot of our medicines are, depending on dose, are poisons as well. You know, how many snake venoms have been studied these days and have really potent uses as medicinal drugs, but obviously if you get the raw form in high doses, it'll kill you. So similar here with the amygdalin. It also includes fixed oils and volatile oils, flavonoids, which we have talked about previously, which are very commonly used in herbs and are often part of the active ingredients. There's also triterpenes, including beta-sitosterol. We've talked about beta-sitosterol relatively frequently on Sperm's herbs, and is in a lot of herbs and supports a lot of beneficial actions of the herbs. Other constituents include amino acids, sugars, and emulsin. All right, let's get into the science of this. According to Chen and Chen, several beneficial effects have been shown in animal studies, including thrombi or blood clot prevention and treatment, anti-inflammation and otitis media. So lowering inflammation in otitis media, which is a middle ear infection, and anti-allergic, antitussive, anti-cough, and anti-parasitic activity. So they also include 2 clinical studies. So these are the ones that I'm more interested in, the clinical studies rather than animal studies, because it shows something in an animal study that doesn't actually occur in humans. So those are not considered very clinically strong. But there were 2 clinical studies. An IV infusion of Tao Ren showed benefit in treating schistosomal cirrhosis, though no numbers were included. So schistosomal cirrhosis is a scarring of the liver, and schistosomal refers to schistomiasis, which is an infection of the liver. So probably not super huge concern in most developed countries. And again, most places that I'm aware of, you can't do an IV infusion of an herb anyway. So and then the second study was an injection of Tao Ren mixed with other herbs was beneficial in treating meningitis, which is inflammation of the arteries. This had an N of 50, so relatively small, just a little bit above statistically valid. Again, injection, and also it was with other herbs, so I take it with a grain of salt. So at least there wasn't a lot supporting its clinical use. But there was a review of studies on peach kernels by Kumari and their team. Recent 2023 states evidence showing benefit for anti-aging, anti-biofilm properties, protection against oxidative stress, cancer cell proliferation, inhibition of type 2 diabetes, Alzheimer's disease, and obesity. So again, I don't think that was super strong in and of itself. A lot of the Chinese herbs, even the very important Chinese herbs, just don't have a lot of evidence, at least in the West. There might be a lot more science behind the language, the Chinese language, but we can certainly stand here for some more science here with this particular herb. Drug-herb interactions. So several studies have looked at drug-herb interactions in Tao Ren. One study looked at its potential for cytochrome P453A4 interactions and found none. So remember, cytochrome P450 is a major target of drug-herb interaction risks, and 3A4 is the one that we're particularly worried about because anywhere from about 40 to 60% of drugs will use cytochrome P450, 3A4 for metabolism. So if something's interfering with that, you have a drug-herb interaction. So the fact that it does not interfere with cytochrome P450, 3A4 is great. Another study looked at interactions with warfarin and found a single case report which illustrated a 54-year-old woman on stable warfarin, an INR of 2.0 to 2.5. That's just a measurement of clotting of the blood, who experienced an isolated episode of INR at 5.5 related to daily consumption of peach kernel. The challenge of peach kernel with original warfarin dose resulted in normalization of INR to 2.1. So D challenge here means they stopped the peach kernel, continued with the warfarin, and it went back to where they wanted it to be. So that's considered C level. D level is the worst. A level is the best of evidence. C level is, to get to C level, it has to be in humans at some level. That's what we have here is a single case study. So fairly weak evidence just with a single case study, but at least it was human. So definitely better than D level, which is either expert opinion, animal studies, or in vitro studies. So Chen continues with drug-herb interactions. And if you're not familiar with Chen, it's brother and sister. John Chen is the brother of Tien Chen's sister. John Chen is actually a pharmacist and is quite well known in our field for drug-herb interaction knowledge. And so what he says, take with a little bit of a little bit stronger to listen to. So Chen say, Tao Ren should be used with caution in patients receiving anticoagulant or antiplatelet medications, as the combination may lead to additive or synergistic effects. Though this interaction has not been documented, the use of Tao Ren may potentiate the effect of drugs such as warfarin. Well, did find some documentation for that. And again, that may be more recent than this book was written. Examples of anticoagulants include heparin, warfarin, or Coumadin, enoxaparin or Levinox. And examples of antiplatelets include aspirin, dipyridamole, persantine, and clopidogrel or Plavix. Again, this is an expert opinion, level D, but it kind of supports the level C evidence we have, the warfarin at least. Having said all that with drug-herb interactions, the American Herbal Products Association's Botanical Safety Handbook, which is a great book with a lot of herbs, and it classifies in herbs potential interactions, says Tao Ren is in interaction class A. its highest level, which says herbs for which no clinically relevant interactions are expected. So look, I don't personally, I do not combine herbs with warfarin, even though I consider myself an expert in drug herb interactions. It's just warfarin is at high risk for drug herb interactions. I just don't do it. Mostly because if something were to go wrong, I don't really have a defense. It's like it's one of those drugs that I've done this. I've had 200 people in a hall. I'm about to talk about drug herb interactions, and I said, "What's the one drug you never combine with herbs?" And everyone just said Coumadin, and I said, "Right, warfarin." Don't say Coumadin. Coumadin is a brand name. Warfarin is a generic name, and the reason why you don't use brand name is because a generic drug can have many brand names, and there are other brand names of warfarin. So prefer to use warfarin. But they were right. This is the one thing, the only herb I heard, the only drug I heard, everyone knew it in that room. So you don't generally combine. I don't feel medical legally you should combine herbs with warfarin, even though more times than not, it's going to be perfectly fine, even in these higher risk drugs. So having said that, I'd be a little concerned with warfarin. I wouldn't be majorly concerned about drug herb interactions with Tao Ren and other drugs. Concerns. So let's talk about some concerns about this. Urbensky and their team note several concerns with Tao Ren. Under the heading of cautions and contraindications, they say it is contraindicated in those with blood deficiency or during pregnancy. And that's all. It's a short little thing, on the vital statistics of the herb at the very beginning of the chapter. It's where they said that. Under the heading of traditional contraindications, they quote the commentary on the Divine Husbandman's classic Materia Medica, the Shennan Bensao Jing Shu, written in 1625. And here they say Persicae Semen Tao Ren excels by nature at breaking up blood stasis, dispersing without restraint, draining without tonification. Overuse or inappropriate use can cause bleeding that does not stop, injuring the true yin. And then finally, under a third heading of toxicity, because of its amygdalin content, this herb is toxic. Overdosage causes toxic side effects. The latent period, 2.5 to 5 hours, and the toxic dose both depend on the botanical species ingested, the type of processing. Peeled kernels are less toxic than unpeeled. The method of administration, decoctions are far less toxic than ingestion of the unprepared kernels, as well as the length of time that it is chewed and the pH of the gastric juice. Right? For children under 5 years of age, 5 to 10 kernels are sufficient to cause side effects. 20 kernels can be lethal. So there you go. So we're more concerned about the children over adults. Those are the ones who typically will have toxic effects from this particular herb. But as we've been kind of saying, look, I buy this herb, I've only seen it unpeeled. So right there, huge safety factor. It's the peel of the skin that we're considered, the skin of the peel or skin of the seed that we're most concerned about when we're talking about this toxicity. So almost all of it that I see is unpeeled. I don't think I've ever seen it peeled. I probably have because I've seen it a lot, but I can't recall any of it. So it's unpeeled. And then on top of that, so we're using unpeeled, so very unlikely for it to be an issue. And then we're decocting it, which reduces that even more so. So bottom line is, if you're using unpeeled Tao Ren and you're decocting it, we're really, really minimizing the toxic effects of this herb to the point where I don't think it's a major concern. Would I be concerned in small children? Yeah, this is not an herb I'd probably use in small children. But for adults, I would not be concerned about. This is a very useful and helpful herb in Chinese medicine. Would not be concerned about it in adults, as long as these conditions are taken. And when I say decoctions, we should make this clear. So decoction, if I think we talked about them. If not, we'll get into it. Decoctions are boils, basically are water extraction. So you put a bunch of herbs and boil it for a while, and then often you'll drain it and add more water, boil it again, and combine the two water fractions and drink it over a day or two. So that's a decoction. But we often use these days we use granules, herbal granules, which are basically the same thing, but then they're freeze dried. And so I consider the granules to be not to be of concern either because those have been decocted as well. And probably, I'm in all again, I'm not sure about this, but I'm pretty sure it would be with the peeled seed. So I'm not worried about using it in granule form either because they go through this processing. So continuing with this toxicity, the symptoms of toxicity are similar to those of cyanide poisoning: irritation of gastrointestinal mucosa, nausea, vomiting, headache, dizziness, general weakness, blurred vision, tachycardia, which is rapid heartbeat, tachypnea, which is rapid breathing, slow or irregular respiration. No, sorry, tachypnea. Yeah, the tachypnea is rapid. So then it says slow or irregular respiration. Tachypnea is rapid. I'm a little confused. Okay, terror, oppressive feeling in the chest, loss of consciousness, incontinence of urine and stool, dilated pupils, absence of pupillary reflexes. So you shine a light in, it won't change. Severe spasms or cyanosis, which is bluing, coma, and shock. There are also reports of allergic reactions, skin eruptions, and pruritus developed at the area of exposition. To avoid toxicity, overdosage must be strictly avoided. When taken directly in pills or powders or by themselves, they should be peeled after boiling in water out for a short time. This procedure substantially reduces the amygdalin content and thereby significantly reduces its toxicity. Peeling is unnecessary when the herb is used in decoctions. Okay. So going on to our other textbooks, Chen say Tao Ren is contraindicated in cases of blood deficiency, and Tao Ren is contraindicated during pregnancy due to its emmenagogic and abortifacient effects. So again, emmenagogic means it promotes menstruation, and abortifacient means that it promotes abortions. Which, in our current climate, depending on where you're at in the United States, giving this herb to someone who's pregnant might be getting in big trouble with the law as well if an abortion actually occurs from it. Brandon Wiseman reiterates these warnings and adds, use it with care in patients with sloppy stool because it moistens the stool. So you don't want to moisten a sloppy stool. Decoctions are less toxic than ingestion as a raw powder or pill, but it should still not be used in excessive dosages. And having said all this, this is interesting. This is the first herb that I've seen from Gardner and McGuffin, which is that botanical safety handbook that we've been using, puts it in its lowest safety category of 3, herbs to be used only under the supervision of a qualified expert. So again, a very important herb, but I do think there are cautions for us to be considered about. And again, with Gardner and McGuffin, the botanical safety handbook, this is based on its potential to create cyanide. So there you go. So that's our herb for today, with all the good and the bad. Never shy away from the bad as well. So in summary, we started today by looking at an important pulse quality, the wiry pulse. Then we looked at the Chinese herb Tao Ren or peach kernel. We saw how important this herb is in moving the blood, which can be used in a wide variety of conditions, including menstrual disorders, traumatic injuries, and different types of pain, as well as its ability to moisten the intestines and unblock the bowels. We spent a good amount of time discussing its toxicity and discovering while toxicity is there, it is minimized by decocting it as we do in Chinese medicine. And there we have it. Another fascinating exploration of a useful Chinese herb. Our next episode, we will be looking at another traditional Chinese formula, Bu Ji Xiao Du Yin, or universal benefit drink to eliminate toxin. This is not so commonly used, at least in my experience, formula for treating illnesses and epidemics, especially something called acute massive febrile disorder of the head. We're going to figure out what that means. Could this formula be of help in COVID or maybe some other infections? Join us as we find out. And as usual, we will be adding something a little different. If you only listen to one podcast episode, please consider this one. Sorry. It's going to be an interesting one. I'm always fascinated with formulas that I am not familiar with. And so I'm excited about this. And in our context of COVID, I'm curious as to whether this is an interesting formula for this as well. I do have a continuing education on COVID, on how to treat COVID. And if I'm not mistaken, I think this does come up in there. So it'll be interesting to see how this can be useful as we're moving forward into the COVID era. With all that, I'd really like to say thank you. If you like this podcast, please do us a favor, subscribe in your favorite podcast app. We appreciate it. Thank you. And you can get this course as continuing education and get more info on my upcoming integrative nutrition series at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, how for bibliography.
Spurbs Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Timothy Dobbins, Roger Campbell.